Visual hallucinations involve seeing objects, people, scenes, or light effects that aren't actually there. They can be simple, for example, spots or shadows, or complex, for example, entire scenes or conversations between imaginary characters. Causes can be caused by psychoses like schizophrenia, neurological disorders, for example, epilepsy, intoxication, sleep disturbances, or stress. Auditory hallucinations include hearing sounds, voices, or noises that don't exist. Often these can be voices talking to the person or commenting on their actions. Causes: mental disorders, for example, schizophrenia, nervous disorders, stress, hearing loss, or side effects of some medications. Olfactory hallucinations involve perceiving smells that have no real source. For example, a person might smell burning or floral scents that aren't present in the environment. Causes can be linked to brain diseases such as tumors, infections, or neurological disorders, as well as damage to the olfactory nerve. Gustatory hallucinations include tasting flavors that don't exist. This could be a metallic, bitter, or sweet taste when nothing is actually being eaten. Causes may be caused by neurological disorders such as nerve damage, oral cavity diseases, or side effects of medications. Tactile hallucinations involve feeling sensations of touch, pressure, or temperature that aren't real. A person might feel something crawling on their skin or physical pressure on their body. Causes: psychoses, neurological disorders, skin diseases, or drug use. Proprioceptive hallucinations include distortions in the perception of the position and movement of one's own body. For example, a person might feel that their body is getting bigger, smaller, or changing. Causes can be associated with neurological disorders or disruptions in the sensory perception system. Micropsychic hallucinations involve perceiving objects or people as miniature. For example, a person might see tiny people or small objects. Causes can be linked to mental disorders or neurological disruptions. Macropsychic hallucinations involve perceiving objects or people as gigantic. For example, objects might seem too large or threatening. Causes may be caused by mental disorders, perception disturbances, or stress. Kinesthetic hallucinations involve the sensation of movement or shifting of the body that isn't actually happening. A person might feel their body or parts of it moving in unusual directions. Causes can be associated with neurological disorders, disruptions in the movement perception system, or drug use.
Audiovisual hallucinations, combination of auditory and visual hallucinations. For example, a person might see a specific scene while simultaneously hearing sounds or voices related to that scene. Causes: often seen in complex mental disorders like schizophrenia or in conditions affecting multiple sensory systems. Visual-Proprioceptive Hallucinations, distortion in the perception of object sizes and shapes. A person might see objects that appear changed in size or shape, such as being significantly larger or smaller. Causes can be linked to neurological disorders or disruptions in spatial perception. Neuropsychic hallucinations, complex and sometimes unusual forms of perception, such as a feeling of changes in consciousness or experiencing non-existent states of consciousness. Causes may be caused by neuropsychological disorders such as dementia or severe brain disorders.